So if you're only missing one tooth, why a dental implant over a traditional proven bridge?
With a bridge, you sometimes, most of the time actually, you have to file down the teeth next to it, which can weaken the enamel, and that puts you right away at a higher risk for cavities under the bridge, because a bridge is, you really can't floss in between, so you have to be more careful with cleaning it. Cleaning it can become a challenge sometimes.
How long do they last, those bridges?
On average, between 7 to 10 years. An implant can last longer if you maintain it better, and you don't have to file down the teeth with an implant like you do with a bridge. You're able to maintain it better because you can floss in between, whereas in a bridge you can't really floss in between.
So with a bridge, you're covering, I mean, it's a total of 3 teeth in a way.
Most of the
with
time,
an implant, you just get your tooth back.
You're just replacing it with that implant, and you're able to maintain that implant and the teeth next to it because you're able to floss now. You didn't shave down any teeth, and you were able to clean it.
So if it was somebody in your family and they were the age they can do it, would you always do an implant over a bridge?
100%.
Always? Every time?
100%.
So why doesn't everybody do it? Is it just they hear the word surgery and they think it's going to be painful, or what are your thoughts?
Yeah, a lot of patients think the cost is way more for an implant, which is not true. It could be the same cost sometimes.
In the long run, is it cheaper because you have to replace a bridge?
Yeah, and if you think about it, you're not losing more teeth in the future, because that could be a domino effect. If you have a bridge with cavities building around them, now you're losing more teeth in the future. So it could cost you more in the long run.
So it's not a painful procedure? I'm sure there's discomfort, but is that something they don't really complain about with single tooth implants?
Single tooth implant is almost the same discomfort level as taking your tooth out. Instead of coming out of the bone, you're going in the bone. And you're numb. You want to be sedated, you can be sedated. But the bottom line is you're numb. So just like having a cavity can hurt without numbing you, having an implant without numbing you, it can obviously hurt you, but you're numb for most, for these procedures.
Now we talked about it in the green room, because I said, well, if you're just missing teeth in the back, why would you want to fill in those holes with implants? Can you tell me why? Because you say it could prevent future tooth loss.
So exactly. Front teeth are made for biting, back teeth are made for chewing. If you're missing back teeth, you're going to start chewing in the front. So it becomes like a domino effect again, where you're losing more, because these front teeth are not they're not made for chewing. They're only made for
you end up losing your teeth.
Yeah, you end up putting more forces on the front teeth and losing more teeth in the future. So that's the first thing you begin with, restoring the back teeth so you can save these front teeth and they can last you longer.